I'm your host, Kai, and welcome back to the Wheel of Wisdom Health Fair. Today, the Grand Wisdom Wheel has spun another topic for us, the ABCs for Aging Men, where we discuss essential knowledge every man needs as he navigates the journey of aging. The decline in testosterone production, often termed andropause or testosterone deficiency syndrome, leads to physical, emotional, and sexual changes. But this is not exactly the same as a woman's menopause, as men do not lose their reproductive ability. Genetic factors also influence how men are affected by age. For example, some men experience male pattern baldness earlier in life, others later, and others not at all. I want to cover some valuable insights that every man should know as they age, including 6 things I wish all men knew before they turn 55. I now present the ABCs for aging men. A. Aging metabolism. As men age, typically around 55 and over, their metabolism tends to slow down gradually. This decline in metabolism can lead to increased weight gain, particularly around the abdomen and chest areas, and a higher body fat percentage. Men may experience lower energy levels and higher feelings of fatigue. This decrease in metabolism is considered a normal part of aging. So incorporate regular exercise and maintain a balanced diet while controlling portion sizes. B. Bone and muscle health. Typically, after 60, men experience natural changes in their muscles and bones. Due to a decrease in testosterone levels, many men begin to lose muscle mass. Osteoporosis can also affect men later in life, leading to weakened bones prone to breaks and fractures. Muscles gradually lose strength, flexibility, and endurance, impacting balance, coordination, and stability. Aim for weight bearing and muscle strengthening exercises. Consume adequate calcium and vitamin D for bone health, and maintain a balanced diet rich in protein and nutrients. C. Cardiovascular concerns. Heart health becomes increasingly crucial for men as they age due to the heightened risk of various cardiovascular conditions like heart disease, stroke, blood pressure, and atrial fibrillation. In fact, heart disease is the leading cause of death for men in the United States. Let's mitigate these risks with regular exercise, maintaining a healthy weight, eating a balanced diet low in saturated fats and sodium, and avoiding smoking, managing stress, and monitoring cholesterol and blood pressure levels. Regular medical checkups and screenings are also essential for early detection and management of issues. D. Downstairs changes. Several changes occur in the lower body systems, notably the bladder, prostate, colon, and digestive tract. Aging can change your bladder capacity and control, which makes you have the urge to urinate more frequently. Enlargement of the prostate gland, a condition known as benign prostatic hyperplasia, BPH, can also lead to an urge to urinate more frequently, can cause a weak urine stream, and make it difficult to empty the bladder completely. The risk of developing colorectal cancer rises with age, making regular screenings crucial for early detection. Also, digestive problems like increased constipation, slower bowel movements, which may manifest as abdominal discomfort, bloating, and irregularity. Maintaining a fiber rich diet, staying hydrated, and attending routine screenings can help men manage these effects of aging on the lower body systems and digestive health. E. Erectile dysfunction. Let's talk about something that sometimes feels a little bit uncomfortable: sexual health. While many blame erectile dysfunction or ED on low testosterone levels, that's often a misconception. Rather, it can stem from physical factors like chronic hypertension, which damages arteries, hindering the blood flow needed for achieving and maintaining an erection. Also, type 2 diabetes, depression, sleep apnea, or certain medications can contribute to ED. Lifestyle behaviors such as smoking, excessive alcohol consumption, and lack of exercise can also play a role. I totally get the apprehension or even embarrassment around discussing this out loud, even with your provider. I've had patients report they've stopped taking their blood pressure meds because of this side effect, as opposed to mentioning this and addressing it together. Listen, I want you to be happy and healthy in every area of your life. But let's not sacrifice one area of health for another. Keep your provider in the loop so they can address your issues, evaluate this problem, which could represent several things, and make the changes to your treatment plan to keep you happy and healthy all around. F, focus on mental well being. Mental health and well being as you age. This one doesn't always get the attention it deserves. Changes in health, employment, or family situations can leave many feeling lost, overwhelmed, or lacking direction and purpose. This can lead to irritability, anxiety, and depression. This happens, and it's probably happening to people around you too. They just aren't bringing it up. It's tough because many tend to brush these feelings aside due to the whole stigma around mental health. But here's the thing, ignoring mental health issues can lead to undertreatment, and that's a big deal. In fact, depression in older adults can sometimes be linked to other reasons, like being a side effect of a medication you're taking. So it's super important to talk to your healthcare provider as they can help figure out the best treatment plan for you, whether it's talk therapy, adding medications, adjusting them, support groups, or a mix of things. Just remember, you're not alone and there is support to help you find your way through. Studies show many men don't prioritize regular health checkups and screenings, with over half reporting not receiving regular screenings and a staggering 33% never being screened for prostate cancer, according to a survey performed by the Cleveland Clinic. Today, I'll be sharing a comprehensive list of screenings recommended for men aged 55 and older. Even if you're feeling perfectly fine, regular checkups with your healthcare provider are important. These screenings, ranging from a simple blood pressure check to more involved procedures like a colonoscopy, can help detect potential health issues early and prevent problems down the road. So here's the list of screenings for aging men: blood pressure, cholesterol, diabetes, colorectal cancer, prostate cancer, osteoporosis, mental health, dental exam, eye exam, hearing test, hepatitis C, and HIV. For those who are smokers or have an extensive history of smoking, I would add an abdominal aortic aneurysm ultrasound and lung cancer screening by a CT scan. This list is a great starting point to discuss with your provider and to determine the timing and necessity of specific screenings tailored to your individual health situation. And as men age around 75, some tests and screenings may become less relevant. Your provider can guide you on which screenings are still beneficial for you and when they may no longer be needed. And that's a wrap on this episode for the ABCs for Aging Men. Thanks so much for watching. Until our next spin, stay proactive, speak up, and keep taking care of yourself.